Here we are with Chris, and she has a right frozen shoulder problem. A little history. We worked on Chris for 4 or 5 visits, and we used ART, or active release techniques. Dr. Mike Leahy in Colorado Springs pioneered and developed, so that was effective up to a point. But we can't get to the point where Chris can raise her arm all the way up. So Chris, what happened to the shoulder and how long ago was it?
Nothing happened to it. I just remember the pain kept getting worse and worse, and eventually I had very little motion in my shoulder.
Okay, how long ago was that?
October, November maybe, I don't really recall.
Of last year.
Mm-hmm.
Okay. Did you go to any other medical doctors or physical therapists or have any other treatment?
Massage therapy.
Massage therapy. And for how long did you go for that?
I've been seeing somebody every 3 weeks, every 3 to 4 weeks, so it's been ongoing even before this started.
Good, okay. Well, when you first came to us, do you remember, like before the ART, before I saw it, from first visit to now, do you remember where you came in, where the restriction range of motion was when you bring the arm out?
I don't remember exactly where it was. I'm guessing probably no more than here. It was not 90 degrees.
Okay. What can you do now?
I get to here and I can feel it catching and I can force it up to here.
Okay, wait a minute. For some reason it stopped. Okay, there we go. Okay, I'm sorry. I thought I was having a technical malfunction. Go ahead and lift the arm up again. How far can you go?
As far as it can go now.
Yeah.
To about here.
That's it, huh?
Mm-hmm.
Okay, how about the other one? Can you bring the other one all the way up? Okay. How about internal, if you bring your arm here, internal rotation?
It hurts. I can definitely feel it here.
Can you bring your arm across in front of you?
No.
That's it, huh? How about bring your arm out and your wrist out?
It's machine at this point.
Okay, and that's it. Okay, well, we're going to do the Trigenics frozen shoulder procedure with Chris here, and then we will get back and see what the results were.
Okay.
Okay, we're back with Chris, and after the Trigenics treatment of the right shoulder. And Chris, let's have you go ahead and lift your arm up. That's as high as you can go?
Mm-hmm.
Okay.
Pretty good, I think.
Just about there. A little bit better than what we got, but still not happy with it. How does it feel when you bring your arm across in front of you?
Actually, that's better than I've been able to do it.
Okay. What was the other? Go ahead and roll the wrist out.
It still hurts. I can feel it trembling up here a little bit, but it seems a bit more range of motion than before.
Okay. A little more range of motion, but it's still tough to do. Okay. Well, I'm going to send this video out to some colleagues of mine and see if they can figure out and help guide us through this. Okay, and thanks for your patience and thanks for going through all of that. Okay, we're back again with Chris, and she's been through an awful lot, and so the frozen shoulder was on the right side, and it was really tough to unlock, and so we've done a lot of work. Chris, to her credit, has been doing a lot of her own work. So Chris, let's see what range of motion you have. You have to lift all. Out there, it just...
Mm-hmm. It kind of pulls up a little bit here, but...
Okay. I see you do on both arms at the same time? Okay, good. All right. What I'll have you do for exercises is bring them both up together. If you can grab onto the fingers with the palms facing out, and grab onto the fingers.
That's it?
Yep, and then push straight up. That's it. I want you to do that, and then bring your hands back. Straight up and straight back. And then that'll be one of them. Then we discuss the ones against the wall.
Mm-hmm.
So, fantastic. Anything?
I'm just happy that I have my range of motion back.
Yes.
And
Very good. Oh, fantastic. All right, glad to see that. Well, thanks, Chris. Thanks for letting me record this, and